diagnosed onto the autism spectrum disorder?
Well, you see, the thing is, that's the beauty part of it, is that it's a spectrum. So you can have children that fall on the very severe side, where they have avoid eye contact, they're non-verbal, you can't trust them, they won't interact at all. And then you have children on the other end where, you know, social interaction is there, but of course not to the full extent. So they will look at you in the eye, they may engage with you as well, but then you'll find it difficult to have a full conversation with them. So it is a spectrum, and it does go from mild, moderate, and severe, and that goes for all three things: the social interaction, the stereotypies, as well as the last thing, which is the OCD feature that these children, the obsessive compulsive feature that these children have.
And in terms of verbal and non-verbal communication, again, you mentioned the spectrum, which we're going to get to. And part of tonight's show is just to create awareness around autism, because it's not a disease that you all of a sudden catch, right? It's something that you are born with.
Exactly, yeah.
And would you agree to say that there's a genetic component to autism spectrum disorders?
Absolutely. I think they are finding that there are more and more genes out there that have been linked with autism. And I think there's currently over 2,000 genes that have been linked with autism, and more are being found. Because autism is one of those things that we in the neurology field will term as a functional disorder of the brain, like epilepsy, for example. I mean, a child with epilepsy, walks around, no problems, but then again, you do scans on these children, and their scans are normal. So it's a functional deficit. So it's like a computer, basically. Sometimes on a computer, you've got your hard drive is basically the structural component, but it's the software that's on that computer. So for these children, it's the software that's the problem. They've got all the parts of the brain that are there, but it's the way the brain works, and that is determined by the software which comes from the genes.
Now, in terms of autism spectrum disorder, and you mentioned epilepsy, is there a link between epilepsy and autism, or do kids who are on the spectrum, do they have a higher risk profile of developing epilepsy?
You're actually right about that. So there's three things that we in the neurology field say go together. Just like in adults, you have the high blood pressure goes with cholesterol, goes with diabetes. So in the children with special needs, if a child has got autistic spectrum disorder, some of the other functional disorders that you have to be wary about is epilepsy, and the other one is attention deficit and hyperactivity disorder. If a child has one, you have to screen for the third. If they have two, you really have to hunt for the third one. Yeah.
Now, in terms of epilepsy, so if a child is diagnosed on the autism spectrum, could they, present without epilepsy, let's say for the first 13 or 14 years of their life, and then all of a sudden, there's an onset of epilepsy at age 15, for example?
Absolutely, it can. Because remember, the child's brain is not static. It's continually evolving. So, you've got the neonatal period where you've got, myelination and all the structural parts being developed. And then as they get to puberty, you've got the influence of hormones that come in on board, and that results in further maturation of the brain. So at all these stages of growth of the child, you will find that epilepsy can occur.
And of course, epilepsy is treatable. I mean, there are treatment options that are open. But there is a challenge. So if the child is on the spectrum and there's non-verbal communication, that adds in a separate challenge in terms of how you treat that specific patient, right?
Yes, it does. Absolutely. Because you've also got to look at what treatment you're using to treat, for example, the autistic spectrum disorder, and then has to look at its interaction with regards to the child. And remember, the anti-epileptic drugs that we use also result in sort of chemical changes in the brain, if I can put that. And that can sometimes worsen certain symptoms of autism, and it can sometimes improve it. So